genetic testing is really kind of having a revolution in epilepsy in the last, well, since 1994 we started discovering epilepsy genes, but the progress was really slow, and even in the last 5 years there's just been an explosion, and now we know hundreds of genes that can be identified that could be the cause of a patient's epilepsy, or be at least contributory in many cases, explain the patient's epilepsy, which is a really big deal, because for a long time, for most of the time, patients come to a doctor and say, well, why do I have epilepsy? And the doctor just says, like, because you do, and that's not, you know, it's not really satisfying to patients. So we know that we are increasingly aware that genetics plays an important role in epilepsy, and for some patients we can identify the genetic cause. And this has been best well laid out by the pediatric epileptologists and the pediatric epilepsy centers that have incorporated genetic testing for a long time into their kind of workup for selected patients. And we know that certain patients in pediatric epilepsy with developmental and epileptic encephalopathy, genetic testing can often yield an answer in up to 50% of those patients. But what's kind of new in the last few years is the bringing genetic testing as an important diagnostic tool to the adult epilepsy clinic. So I'm an adult epileptologist who's interested in providing genetic testing for selected patients with potentially genetic epilepsies. And so we have a clinic at our center where we see referred patients who want to look into the potential genetic causes of their epilepsy. And that's not yet for everybody, but it for patients who are more likely to have a genetic cause of epilepsy. And so we've been doing this for about 8 years at our center, and we followed over about 95 patients who have been interested in looking into the genetic cause of their epilepsy through clinically available genetic testing. And we do different types of testing based on patient and other factors. So in our study of 95 patients, we were able to give a diagnostic answer to 18 patients. So 19% of our adult population that we saw specifically for genetic testing, we were able to give an answer. And so this is one of the first studies looking at genetic testing in the adult epilepsy population.
So then obviously,
as a dedicated